Welcome back, peeps, to another episode of the Tooth or Dare podcast, peeps, with your peep, Irene. Hello. I hope you're having a great day. If you're listening to this in the car, welcome. If you're watching this on YouTube, nice to see you again. Hope you're all having a wonderful day. What day is it for me? Today's Monday morning. I'm about to go to the office to, do the patient thing. Had a wonderful weekend, and this episode was recorded this weekend it was actually Thursday with Dr. Nekky Jamal live at ODA at the Philips booth. And it's part one of two, getting to know who Dr. Nekky Jamal is, who's a really cool dude. And you haven't seen him on my podcast before, but I've been on their podcast. He also has a co-host named Akil who interviewed me a little while ago. And I think after part two, I'll release the kind of podcast that I did with them on like a Thursday, kind of like a throwback situation. And I think that'll be really fun. They're both really interesting dudes, and particularly Nekky, who I got to know kind of a little bit more on a personal level during this episode, really released a lot of stuff about, his upbringing and the reason why he became a dentist, and now why he mentors other dentists, helping them learn how to navigate tough extractions and not make the mistakes that he made when he started taking out thirds. So really cool. So that was my Thursday. Did a couple of interviews, and especially this one. And then Thursday night I flew out to Seattle, Washington to deliver a lecture at a dental hygiene study club there that's run by Ben Johnson, who's he's an oral surgeon. Not also an oral surgeon, but he is an oral surgeon out there. And that was really cool too. I'll be back in, I think, September to do another study club in Seattle, Washington. So if you're in the area and you want to come, send me a message and I'll figure out how to get you registered. So yeah, that's it. That's all. I learned a lot in this lesson. I learned a lot of lessons in this episode, just talking to Nekky, and it was an interesting morning. Things weren't working out the way we wanted them to. The screens weren't working. The table was a different size, but the two of us kind of just sat there letting people do what people do. And really had a moment of appreciation, not for what we were just about to proceed to do with the podcast, but that we are pretty fortunate to be kind of in the positions that we are. So it was a learning moment from the beginning of this episode. So I hope you enjoy it. Thank you so much to our friends at Philips for sponsoring this episode and allowing us to come into your space. It was wonderful. And our sponsor message today is from someone on their team answering a very important question. How do you prevent sensitivity when whitening, particularly with Zoom whitening, before we begin? So let's head into that sponsor message, and then I'll catch you on the flip side of this episode. Peace out, peeps. Bye. This episode is sponsored by our friends at Philips. Obviously, you can see that we've been recording here if you're watching this on YouTube. I'd like to introduce you all to Lindsay Daly, who is the Professional Education Manager for Canada.
Correct.
Also an RDH.
Yes.
Also a science freak. And yes.
Yes.
And also a really cool person.
Oh, thanks.
Today's topic that we want to discuss is whitening sensitivity. And I use that as a very broad topic. More so sensitivity management, prevention, and what dental professionals can expect, or the conversations we should have with our patients before we decide what we're going to do, whether it be take home, whether it be an in-office Zoom procedure. What should that conversation kind of look like, and how do we as clinicians take this as part of the process of care, not just managing something if it happens at the end?
Right. So we know with whitening, and not just Philips products, with whitening we can have sensitivity. The reason is because of that fluid movement and the tubules, and so sensitivity happens sometimes, right? And we tend to react reactively when it's already there. And usually desensitizing agents don't start working right away. So it takes a couple of weeks for, potassium nitrate to start working. So we should be kind of dealing with it proactively, like you said, versus reactively, because sensitivity is actually, I believe, don't quote me on this, but one of the top reasons that patients don't fulfill the treatment recommendation on
I
whitening.
mean,
So that's stop.
anecdotally, I can tell you that that's the first question is, they'll click off on their medical history that they are dissatisfied with the color of their teeth. And when you ask, have they whitened before, are they considering any form of whitening, they're like, I've heard that it makes your teeth sensitive. And they immediately use the P word, pain,
Right.
versus, it being a temporary discomfort. And maybe that's just because there wasn't a protocol in place.
There wasn't a protocol.
And wherever,
wherever they went, and so, and then if they're dissatisfied with, and then if you ask them, oh, you did whitening, were you happy with the color? Sometimes they say, oh, no, it didn't really work. And then the next question should be,
they didn't finish.
Well, did you finish the 2 weeks or whatever was recommended? No, my teeth were sensitive. So it's exactly a protocol. Yeah. So you want to address it. So we suggest when you're doing in-office, I've seen your post that you did talk about the protocol. So you want to recommend a desensitizing toothpaste for your patient 2 weeks before. You can recommend ibuprofen about a half an hour prior to treatment for in-office if that's okay and not contraindicated for your patient. We also suggest using Relief ACP, which is found in the in-office kits. It's a phenomenal product. There's amorphous calcium phosphate, so you kind of block those tubules, partially block them, and then you have the potassium nitrate. So that comes in the in-office whitening kit. So we always suggest making those trays
in advance
prior to doing the in-office treatment so that you can send that home with your patient, direct them to wear the ACP prior to coming in. They can even use it for a week or so before. They can leave your office wearing the trays with it in their mouth. It really just helps things be more comfortable.
How do you feel about a high parts per million, aside from like an over-the-counter potassium nitrate toothpaste? How do you feel about like a high 750, 900, 1100, 5,000 parts per million.
100% sodium fluoride. That's very important that it's sodium because something like stannous fluoride does completely block the tubules, so it can interfere with the results. And as well, it does stain. So you want to stick with the sodium fluoride. So yes, or there's like MI paste that are partially blocking the tubules. So solutions like that.
Yeah,
exactly.
Absolutely. And I think when someone comes to you and says, I don't want to whiten my teeth because of the fear of sensitivity, you can confidently say, we've got a process in place for that. If it's not for sensitivity, is there any other reason why you wouldn't want to do it? Then let us control that. So number one is take those impressions ASAP. Right away. Don't wait to take them in between sessions like a lot of people do. Like patient comes in, they're seated. You take their impression, and then you put on the gel and the 15-minute timer, and you're frantically running to
hoping
pour.
Your stone hardens
enough. And then you come back, you take the gel off, you put another layer, you run out, you separate them, and you drop them, and then you're back, and then you cut them, and we've done that. We've all done it. Let's be honest. But is it the best course of action? No. So take the impressions right away. If you know you have someone that suffers from sensitivity, send them home with the ACP gel and a higher parts per million toothpaste or a toothpaste for sensitivity.
Make sure it's not the Rapid Relief or Pro Relief.
You want
it's because they completely block the tubules and it can interfere. So you want to do a potassium nitrate.
So we like a ClinPro 5000. We like a MI paste. We like a sensitivity like Sensodyne. Like regular Sensodyne. The OG one. So those are 3 good ones. And obviously they come in a different price point too. So that. And then over-the-counter Advil for the inflammatory. And then take those trays home right away.
During procedure, the clinician or whoever's performing the procedure can paint the Relief ACP on the linguals to help during the procedure. So that's all kind of in office.
So how do you do that? Just with like a little Q-tip or something?
Yeah, you can just use a little brush.
Micro brush?
Micro brush, just
and that helps
on the linguals.
too. And then another tip and trick that I use is if I notice that there's wear on the lower upper anteriors, I take the Liquid Dam. I take the Liquid Dam to the incisal edges. I even kind of go down a little bit on the lingual side.
And you can go down on the lingual. You can go up if there's abfraction or cover because the whitening happens in the dentin. You're not going to have what we call like a
little
tan
spots.
line. The tooth will whiten. So it help protect and make that patient comfortable.
Awesome. Well, you heard it here first, y'all. Thank you, Lindsay, for these tips.
Always a pleasure.
And hopefully this helps clinicians feel a little bit more comfortable getting over that, initial barrier.
Yeah,
Because
yeah.
nobody wants discomfort.
No,
I
and
mean,
you don't want your patient to be
and that's not a good
discomfort.
referral for us
No,
too,
absolutely.
right?
No.
Those Google reviews are very valuable.
They are very
Cool.
valuable. Yeah.
Here's our episode. Welcome back, peeps, to another episode of the Tooth or Dare podcast, recorded live at ODA at the Phillips booth with my friend, Dr. Nekky Jamal.
Yeah.
What up, bro? Oh my God, you're here. You're here in Toronto.
It's finally happening.
You're here in my hometown.
Yeah.
And how are you?
I'm doing well. I'm really pumped up. I got
Are
a couple
you?
lectures today, but I don't give a crap about those because I'm here. Truth or dare, let's go. This is what I'm talking
love
about right
this.
here.
Okay,
Man,
so
no. This is my show now.
I feel like you're about to bust out in a rap. You're
No,
like, in West Philadelphia, born and raised.
To all the listeners, because I know
What's
there's tons.
There's 3 of them.
Here's the
same
thing.
3.
Maybe my dad will check in, so now you got 4. But Irene, what everyone needs to know about you is how amazing you are.
Oh.
Because you really embody the mentality of less egos, more amigos.
Oh.
Because man,
I
there's
love that.
there's so many egos in dentistry. We all got one. Let's be honest, right? But Irene's coming out here and she's trying to help everyone she can. She wants nothing in return. I'm like, Irene, I got a gift for you. I want to bring you my favorite coffee
They have
beans.
no idea what you're talking
and
about.
And I'm like, man,
You're gonna make me cry.
no, Irene. They don't need to know what I'm talking about. But Irene, your persona and what you're doing for everyone around you is changing our profession, and this is what we need. And this is what I want to be. Like you are the way that you talk, the way that you carry yourself, the way that you bring everyone along the ride with you. This is what we need in dentistry right now.
God.
So hell yeah, Irene, let's go.
I'm gonna cry. That's a lot. That's a lot right off the top here. This is supposed to be me drilling you, not
No.
you like.
So where were you
giving
born,
me-
Irene?
Oh my God, in West Philadelphia. So I was born and raised. Wow. Okay. Well, for those of you that you will see, because I haven't aired it yet, but I was on your podcast.
Yeah.
So this is what he's talking about. He's talking about your podcast, which is the Hi, I'm Doctor podcast. I literally am tearing up right now. You're making me ruin my makeup. Is a virtual podcast, but you're recording live here for the first time.
Totally, it's my first live
And
one.
Akil,
Yeah.
who's your podcast co-host, he's a dental student, and you'll hear all about him, came over to my house. And I was like, just opened up my suitcase full of stuff. I'm like, okay, so take a video of how you set this all up. Anyway, so that's what we're talking about. But it's my pleasure. And I think podcasting is such an underutilized forum in dentistry, although we have so many podcasts, not nearly as much as they do in like healthcare and like mental health space. I mean, even like just like kids stuff. There's more podcasts in kids gaming than there is in dentistry.
Oh, totally.
So we talked about this like earlier, like what are we doing this for? It's like to help people learn, right? To get better and
it's just so much fun. And even people are saying like, oh, you helped me get through this, or you helped me with this. I'm like, no. I hate to say it, I did it for me.
Yeah.
Because I got to meet this person, I got to talk to them, I got to pick their brain.
Read what it says in my notebook.
Was this?
This is my podcast notebook.
I like to interview people on podcasts, so I can call it education, but really it's so I can make new friends. Hell yeah. It's so true.
That's what. So every time I start a new podcast notebook, which is like every season I have a new notebook, I come up with like a reason, like
mantra.
my reason why I do it. And
it's your why.
It's my why for podcasting. Okay.
I love it.
Less tears, more education. But first, part 1 of 2, let's talk about you. Like, where did you come from? Where did you, let's take me back to birth. Like, do you remember what, like, sliding out of the womb was like?
It was slippery,
Yeah.
I think.
Very moist. Ew. I did it.
It's such a word that we don't want to say, right?
I bought cupcakes for the team this week because it was, so we celebrate like random things. So it was like National Cupcake Day. So I just like Uber Eats some cupcakes, and one of my assistants called it moist, and we were all just like, we all stopped mid-bite and we just stared at her. So tell me, where'd you come from?
I was born and raised in Calgary.
Okay.
And but life was good. I don't know how deep you want to get
Deep.
here.
I mean, and I will dig.
You want?
I'll dig.
You don't even have to dig. Okay?
I am Barbara Walters today.
When I was in grade 4, we moved to Africa. That's where my parents are from.
Where in Africa?
Nairobi, Kenya.
No way.
Yeah, they're from Tanzania, but
wow.
So we lived there for a year, and then realized
like right in Nairobi, right in the heart of Nairobi.
Right in Nairobi.
In Nairobi? Did you say Nairobi?
Nairobi.
Nairobi.
Yeah. Nairobi. Yeah. We lived there for a year, And then we moved.
So do you speak
moved back
Swahili?
I wish. I used to know some words. I went to a private school there, and it was an English private school. So it's just what you do when you're there. If you're English.
Yeah.
Like,
so do you remember much of it? I've been to Africa. I've been to Kenya and Tanzania and Nairobi, and I remember Nairobi to be just like this crazy busy city.
Oh, totally.
Just like people everywhere.
Totally. And
roads
crime
not great.
Yeah.
I mean, I didn't experience any crime, but I remember it to be like
I still
intense.
remember the security guard, because everyone down there, like, you have a security guard, and like, don't get me wrong, we do not have money. Like, we do not come from money, but we have a security guard there. And
I mean, you have to. It's either that or
you get pow pow, right? And or pop pop. Anyways, I remember someone paid him off.
No.
And he was missing for a day, and then the house got broken into, the car was stolen, like. But that's just what it is. But I only lived there for a year, so like, and I was a kid.
What made your parents want to move back from going from Calgary to like East Africa? That's like
that's where they were from, and I think like, there was no good like business opportunities here. My parents don't have very much education, and I love my dad to pieces, and he never really went to school, and so he was a construction store clerk at a drywall store in Calgary for like almost 20 years.
Wow.
And so I think he went there just looking for an opportunity, right? And then came back here, and my parents got divorced.
Okay.
When I was 13.
When you moved back.
And that, honestly, Irene, that changed my life.
Oh, no.
For the best.
Really?
Yeah. So I don't know, I'm just going to say it, okay? I haven't seen my mom since 1993.
Really?
No, 1996. I haven't seen my mom since 1996. Everyone's like, Nekky, like, don't you want to reach out to your mom? Whatever. I haven't seen my mom since 1996.
How old were you?
13.
13. Okay,
and
so same time.
Yeah. And the last words she said to me were, have a good life, you're going to amount to nothing. And I said, okay, I'm going to show you.
Oh.
And boom, I got to work. And
wow.
that's still like, I know.
Why
it's
did
like,
she say that to a 13-year-old?
I know,
like,
right? It's just, messed
did she
up
like
family.
not want kids?
I
or?
guess. It just, I don't know. She never reached out to me. I've never reached out to her.
Did your dad ever say anything of like?
No, my dad is such a badass, because like he didn't even know how to cook. Oh. And here he is with a 13-year-old in his lap now, and being like, where do we begin?
Yeah.
And so he learned to cook. He learned to take care of me. And he was always like, Nekky, do you want, like, I remember driving in a car. I'm going to tear out. I'm driving in a car around Calgary because we had nothing left to do. And back then, gas was like $49.9. So that's what you do, right? You drive.
Yeah.
Yeah. And I remember him saying, "Is this the life you want? Is this what you want in life?" And I said, "No." He's like, "Broke. You don't know where your next meal is coming from, right?" And then he was like, "Get to work."
Wow.
Boom. Got a job at Pizza Hut.
Like
here. the next week, started working at Pizza Hut. And
that was your first job?
That was my first job. 14 years old, working at Pizza Hut, because you can get a social insurance number at 14. Got a job at Pizza Hut. Worked. I put away $250 every single month since then, paying for school. And so I saved up. I opened up my own RESP.
No way.
Yeah, and then so I started, and I made enough for my first couple of years of university, working, flinging pies and slicing or slinging slices. You know what I mean? That was my life. And I remember I'd work like 3 a.m. Saturday night. What are you doing this for? Because I got to go to school. I got to go to school.
Yeah.
And I was never the smartest kid. I'm still not the smartest kid. I got meat hooks for hands. I'm not the best dentist out there. We care, and we have this drive in us that like no one can take that away from.
But not everyone has that. I mean, if you can, like, and I've interviewed a lot of people, and you hear a lot of different stories, right?
Yeah.
And like the why you got into what you're doing, and we all have a different reason why. The real important question that I'll ask you later is why did you stay? But I think the driver for some people, that could be a huge detriment. Like home life, like you could have taken that conversation you had with your mom, and it could have put you in a deep depression.
Oh, totally. Drugs and all that shit.
And you could have turned out, like, we could be having a very different conversation today.
Totally. I think the thing is, like, all my friends back then, they smoke weed, they drink, all that kind of stuff, and she said, you're just going to be a drug dealer. You're going to turn out to nothing. And it was almost just my mind. Well,
do you think she was, like, portraying her own insecurities out on you?
Know.
Like, have you ever, like, had a therapy sesh with someone to
Oh,
like
yeah.
help you understand?
Oh yeah. Like I'm in a really good place. Yes, I have gone for therapy for sure. Everyone
no
needs
shame
to.
in it, I
No,
mean,
everyone
yeah.
needs to. It's
Yeah.
a must. But like you have to talk things out. But no, I couldn't tell you to this day. And people ask me like, do you have a desire to reach out? And I'm like, no, I'm fine.
Yeah,
like
no.
me and my dad were homies, and no, I don't know what I would do without him. And he's absolutely amazing. And the thing that changed my life was when I was at that time and we didn't have any money and we didn't have a place to sleep because it was just my dad and I and we had zero money. We were sleeping at friends' houses to get by. My dad, now I'm gonna really cry. He took out a loan just so I could get braces.
Stop.
Because I had a gap between my teeth so wide you could drive a truck through it.
No way.
What kind of fat, chubby, 6'4"
We need a
kid
photo of this.
is just?
We need it. We need it then and now.
I don't even know if I have one.
Oh my gosh.
Yeah, I don't have any photos or anything when I was a kid.
Wow.
Anyways, he took out loan, got me braces, and honestly, Irene, it's like I grew 2 inches. It was like I could stand up with my back
Yeah.
straight. I could talk to people. I could look people in the eye. Yeah, I was still a chubby kid, but at least I had confidence. You know what I
Right.
mean? And then it was like, dude, I need to give someone else that confidence because it changed my life.
Is that what made you want to go into dentistry?
Absolutely.
No way.
Yeah.
That
Totally.
one.
Totally. I don't
just
care.
that, like-
I honestly, I know there's other people out there that repair heart valves and get rid of brain tumors, and
I mean,
that's not me.
yeah.
I'm here to give someone the ability to walk 2 inches taller. That's
Hmm.
my mission in life. And whether that's through dentistry with my patients or other dentists, helping them achieve their practice success and getting out teeth faster and just giving people the confidence to. I
Yeah.
just want to be people's hype man because there was no hype man when I was a kid. My dad was my hype man, giving me braces, right? So I feel like my purpose in life is to be that for my other dentists, and it's just so wicked that at 39 years old, I'm where I want to be,
Is this where you thought you would be?
This is not where I thought I was going to be. This is way ahead of where I thought I was
No
ever going
way.
to be. Oh, I never thought I was ever going to. Like, I remember going to PDC, Pacific Dental Conference,
Yeah.
2009, brand new grad. And I remember going to a lecture, my very first CE, and I look at this guy on stage, and I'm like,
Damn.
how?
Yeah.
How? Who is this guy? And he was talking about some 3M composite or something
Yeah.
like that. And then he's like, hawking all the 3M products. And I'm
Yeah.
like, is this a commercial? Or is this
Yeah.
like, and I'm like, no. This is, it's still cool. Like, you got a room full of people that like look up to you. And then I got my first speaking gig in 2015. And
How did you do that? How did you? First of all, where'd you go to dental school?
U of S. So
Okay.
University of Saskatchewan. So I grew up in Calgary. So you
Okay.
either go to U of A in Edmonton, UBC in Vancouver,
Yeah.
or U of S
Cool.
in Saskatoon.
What'd that run you?
Back
then.
Back then, so 2009, it was 32 grand a year plus
living,
plus living,
books.
plus supplies. So like I graduated
Yeah.
about 200K in
It's
debt.
not bad, man.
No, especially
Canadian
now.
dollars.
Canadian.
Yeah,
that's
Canadian
pretty good.
dollars.
So it's like what, 20 grand
Americans
American. Yeah.
that's like 1 year at NYU.
Oh, totally. Totally, man.
That's 1 year.
Yeah.
So I've got like asked that question a lot, and like the like amount, like highest amount is someone graduated 750K USD.
Oh, that sounds like an orthodontist from USC.
Yeah, exactly, exactly who it was. Yeah,
Yeah.
crazy.
That's nuts. Yeah.
Yeah.
I don't even know how an American, I don't know how you even begin to pay that off.
Kidney donation, like
Totally. I'll only
I
give
think
you 10
I think in
grand,
the
man.
U.S. they pay you for your blood. Like I think that's what you just figure out how many times can you donate blood, and then you just walk around with the bag.
Right?
Jeez.
I'm making more.
Which one's the organ that regenerates? Is that the liver or the kidney? I can never remember.
We'll
It's
take
definitely
both.
not the pancreas. Okay, so then, and you never wanted to go into ortho.
No. It's
Interesting.
just so boring.
You were
So
just
boring.
like, thank you for fixing my gap and giving me 2 inches
Yeah.
on my personality and my
Yeah.
but like you could keep your wires. And
Totally.
brackets
I
and-
never found it like when I got into school and you learn about ortho and then you go to shadow them and it was just like,
Nah.
seeing 90 patients a day, if not more. Like
Yeah.
it's just not fun. They have a great, don't get me wrong, they have a great work-life balance, yada yada. It just wasn't for me. It wasn't hands-on enough for me.
Yeah.
Yeah, and I actually thought I was going to go into prosto school.
Oh.
And then, like, my profs during school were like, Nekky, like, you should apply here. We'll write you recommendation letters. You have the grades. You should do this. And then I graduated, and I was like, I hate crowns. And so like it's, I haven't prepped a crown in 7 years.
No way.
Because I just don't like it. It just
You haven't
stresses,
prepped a
stresses me
crown
out.
that long?
Yeah.
So what does your day-to-day look like?
I just take out teeth, take out
That's
a lot of wisdom teeth to do sedation, and then do implants, and I love that part of life. I see maybe 7-10 people a day,
Cool.
and I have so much fun. I get to build relationships with my patients, and people always ask me like, well, why didn't you just go into oral surgery? And I said, well, I probably should have.
Yeah.
Let's be honest. Is that one of my regrets in life?
I mean, you still could.
Absolutely. Oh, I totally still could, but like I have such a great practice.
Yeah.
Like I have 2 other partners, and in 2009 we bought out a clinic, we grew it. Now we're at 22 chairs and
22 chairs.
And it's just such a great
Damn.
practice. And so I have so much fun at work, and I'm like, I don't really want to give that up.
Yeah.
And like the same kids that I was coaching basketball on when I first was a dentist, I'm now taking out all their wisdom teeth, and it's like I built this community around me.
So
You know what I
cool.
mean? I have an amazing office manager. I have an amazing, like my partners at work.
Yeah.
They're awesome.
It's hard when you're like
No.
so
Yeah.
deep
Totally.
to like leave it in someone
Oh,
else's
totally.
hands.
I totally hear you. And then, but
Yeah.
I'm having so much fun. I have the ability to come out here and meet new people, and it's wicked.
Yeah.
Yeah.
Cool. I think we should segue into our part 2.
Okay.
Any final words for the peeps listening about Nekky life? This is the episode with Nekky, if anyone's wondering.
I don't.
We'll leave it till the very end.
Well, yeah.
right.
I just don't even know, because life can take you in so many different directions, and until you say yes to everything, you'll never know where it goes.
Yeah.
And that's exactly how I got to where I am today.
Oh my God.
Yeah.
All right. Stay tuned for part 2.
Yeah.
Dr. Nekky.